Welcome to this joint video between Eaglet-Eye and BostonSight Scleral-Ig. It's a great pleasure to be here with Dr. Karen Carrasquillo. Karen Carrasquillo is VP of Clinical and Professional Affairs at BostonSight. My name is Arnie Snepvangers, and my role is that of CEO at Eaglet-Eye. And we're absolutely thrilled to introduce to you the new Scleral-Ig connection between the eye surface profiler and the BostonSight Scleral-Ig lens. And in this video, we're going to dig deeper into that. The eye surface profiler basically is the missing piece in the puzzle for effective and precise fitting of scleral lenses. And so we've been working throughout the years to develop the software and develop the device, and always been 100% focused on specialty lens fittings. And it's my pleasure to talk to you a little bit more about the device itself. It measures up to 20 millimeters of the anterior surface with about 500,000 data points. And it does so both for the cornea as well as for the sclera at a very high accuracy. So 2 microns for the cornea, 10 microns for the sclera. And we've gone a step further than just having a device that measures the front surface of the eye. We've also developed smart fitting lens algorithms. And one of those is for the Scleral-Ig lens. The system behind our product, the eye surface profiler, is called profilometry. And what it does is, in a single shot, it will illuminate the eye with a line pattern. And initially, you will have instilled fluorescein onto the tear film, so that when we hit this cobalt blue light pattern on the eye, it will reflect it back. So both from the cornea as well as from the sclera. And that will give this full coverage. And as you can see in the line pattern, there's no hole in the data. It's equally spaced between the center as it is in the periphery. We've always had a very science-oriented perspective with our company. And we've collaborated closely with many scientific researchers, and has resulted already in more than 20 peer-reviewed publications, a whole host of scientific posters. And another focus that we've had with our company is that we've always been 100% focused on specialty lens fittings. Our passion is to empower specialty lens fitters wherever they are in the world, and whatever lens they actually fit. And so these are the typical maps that you would be able to generate with our device. And so if we just look at the cornea for these maps, so from left to right, we see a prolate spheric cornea, and then one to the right, a more toric one. And in the center image, you see a central red cone of the keratoconus of this particular patient. And one to the right, this is actually a pellucid marginal degeneration, where the cone is actually right at the periphery of the cornea. And the one on the far right, you can easily detect that this cornea in the center has been flattened. And that flattening, for this case, was done by LASIK. So this is a post-LASIK patient who can, when you are fitting a scleral lens on that, can be quite a challenge. So it's very good to have a device that can measure that. If we move to the scleral shapes, and again, we go from left to right, you see that the one on the far left has a with the rule toricity. So you see that on the horizontal meridian, it is more elevated and indicated by the red colors. And vertically, it's dipping down steeply, indicated by the dark blue colors. And if we go one image to the right, we see that this toricity now is, as for this eye, it's oblique, it's diagonal. So it will have, the shape will have great impact on the fitting of your scleral lens. So it's really important to measure that. And the one to the right there, you see that actually it's quite irregular. So there's a little bit of elevation on 2 o'clock, and there's one that is the similar elevation at 9 o'clock, and there's a clear depression at 6. So it's a little bit all over the place. And the one on the far right, you see on the sclera on the right side, you see this white dot surrounded by a red circle indicating pigwicula. Without the machine to measure this can be really hard to fit. And with the eye surface profiler, it becomes really, really straightforward. The measurement process, basically, as I mentioned before, you need to apply fluorescein to the eye, and it's a fairly, the initial preparation of the patient takes a couple of minutes, so 5 to 10 minutes. And then the actual measurement taking is, as I said, it's a one-shot measurement. It's a fairly quick process that you go through. The next step in the scleral lens fitting process is that you select your lab. And you see here, BostonSight Scleral-Ig has been selected, and you select based on the HVID measured by the eye surface profiler. You select the most appropriate diameter of the lens. You hit calculate, and out comes the prescription of the shape of the scleral lens. And with the new connection that we're launching with BostonSight and the eye surface profiler, the DirectConnect button, you can basically push all of this data straight into the FitConnect online system by BostonSight, and make the whole fitting process that much faster and that much easier.
Well, thank you very much, Arnie. I really think that one of the great benefits of this new software release and innovation from Eaglet-Eye, ESP, and this DirectConnect button, as we feature this for the first time with BostonSight and the Scleral-Ig product, is, as you said earlier, this allows clinicians and practitioners a process that goes from an image acquisition directly to the lab for manufacturing. It bypasses the step of choosing what is the best initial trial lens. You just elucidate, obtain the scleral-shaped data in the form of that scleral-shaped image from ESP, and then you just send it there directly to the lab. From a practitioner point of view, when we think about patients and an efficiency process and reduce share time, it really doesn't get any better than that. And so I'm going to discuss some few fitting examples in cases where we use the Scleral-Ig together with the ESP. But I figured before we go into that, I just wanted to show the audience and practitioners a process, an example of the process going from the DirectConnect button directly to our FitConnect ordering platform and directly to the lab for manufacturing. Here you can see the process of proper fluorescein installation, which you alluded to earlier, Arnie, and how that is key in order to obtain a good image. Once we center the eye and open the lids, we're ready to fire, and we acquire that image. And once we acquire that image, as you pointed out, we go to the first lens fit algorithm, and we choose BostonSight and Scleral-Ig as the product. And one of the great things about the Eaglet-Eye is that it gives us, the practitioners and the users, information about the HVID. And Scleral-Ig comes in 3 diameter offerings. So knowing the HVID of your patient, you can choose either your 18, 18.5, or 19 millimeter lens. Then you hit calculate. As you pointed out earlier, once you hit calculate, the ESP is going to show clinicians what are the predicted changes that need to be incorporated into the Scleral-Ig in order to fit that patient in a personalized and a customized manner. And those changes are in relation to change in sagittal height, changes in base curve, which takes care of the clearance into the peripheral corneal region, into the limbal region, and changes to the haptics, each of the haptics in a quadrant-specific manner. Once you obtain that information, which is very fast from the calculate, then you go to the DirectConnect feature, which takes you directly into our FitConnect ordering platform. You log into your FitConnect account, and automatically the data is going to be submitted to the FitConnect platform. The first name and last name will be carried forward. In this particular case was whited out for the sake of privacy of the patient, but that information is going to be carried forward to FitConnect. If the patient is an existing user, you just look that patient up in our platform. If it's a new patient, you just register the patient. Once you confirm the diameter and the eye that you're fitting in FitConnect, you just start your order. And then all you need to do is go here where it says apply ESP data and click there. And the data will be automatically, when you apply, all the changes that are needed to be incorporated into the IG design will be automatically incorporated. You just need to proceed to enter ovary fraction data, material changes, etc., and click go to sag and haptic changes. This is actually a great benefit that BostonSight Scleral offers practitioners. If you're using our trial lens set, which is a data-driven lens design and has scleral shape data already incorporated into the design, if you needed to tweak the lens design, you have graphical representations where you can modify the lens design in real time, and you can do changes to your sagittal height and base curve and see how the lens design is being changed. So that is a great benefit. But with the ESP DirectConnect feature, all that data is automatically populated into the graphical representation data. So you don't need to worry about that. All you need to do is click save and continue. And it takes you to the final step where you finalize your order and you place your order and you're done. And you sent already that information directly to the lab. Again, from a efficiency point of view, it really doesn't get any better than that. It is important to mention and note that Scleral-Ig, as it's powered by Eaglet-Eye's ESP, is the first and only image-guided option in the large diameter offering in your 18 plus millimeter lens sizes. And why is this important? This is a very important feature and important to leverage amongst all of us clinicians, because when we think about the complex corneal disease spectrum, right? So let's just say that we now focus and talk about the irregular cornea cases, let's say ectasia cases, or when we're talking about grafted corneas or post-arcade cases. We know when we're dealing with ectasia cases, for example, that the total sagittal height of these scleral lenses that are meant, right, as we know, to fold the cornea, the total sagittal height in most of these cases result in a very tall and high lens. The importance about a scleral lens is that we land the weight of that height and distribute it over a large surface area, so that when we're resting that lens over the conjunctiva that overlies the sclera, we do so in a way that the landing is smooth, that we're distributing that weight as much as possible to avoid complications of lens compression, to avoid complications potentially of limbal touch, of limbal compression. By having a wider landing in that lens haptic, we're maximizing our ability to be able to clear that nimbus efficiently. This is extremely important, especially when we're dealing with grafted corneas, because we know that these are more susceptible irregular corneas that can be highly susceptible to suction forces. And by avoiding complications of compression and avoiding complications of lens settling over time by distributing the weight of this lens over a larger surface area, we're actually also promoting best ocular health, especially in a long-term manner, and avoiding complications potentially from edema and neovascularization that can come as a result of suction. So that is actually very important when we talk about the irregular cornea cases. But now let's just think about the benefits of the Scleral-Ig offering, in particular as powered by the Eaglet-Eye ESP, and having that scleral shape elucidated for us. These diseases are not called ocular surface diseases for nothing, right? They're not called corneal diseases. We refer to them as ocular surface disease. And the reason that is because we know that the ocular surface is beyond the cornea. The ocular surface encompasses both the conjunctiva, cornea, conjunctiva, accessory glands, right? The lids, etc. So when we use and take advantage of the Scleral-Ig and the fact that it is the first and only large diameter image guided offering, we're able to maximize ocular surface coverage. When we're dealing with ocular surface diseases and these fragile and compromised corneas, why is this important? Well, if we let's just take, for example, a dry eye, severe dry eye case. If we provide with a scleral lens the benefit of protecting the cornea and providing that constant lubrication and promoting an adequate physiological environment that promotes healing, that is wonderful. But we have seen cases, and we know that the conjunctiva is also susceptible to desiccation, and we have resulting hyperemia and injection from chronic exposure. When we are able to protect with a larger diameter lens and maximize the coverage of that ocular surface, these eyes become quieter and become more comfortable, especially long term. Let's say, for example, you are dealing with a Stevens-Johnson's case or any other case that is susceptible to the anatomy of the lids, for example, from entropion, ectropion, distichiasis, or just keratinization. By maximizing the ocular surface with the use of a large diameter like the Scleral-Ig, you're also protecting that ocular surface from that environment or the external environment in the case of chronic exposure, for example. So having a image-guided offering in the Scleral-Ig powered by the Eaglet-Eye ESP allows clinicians the benefit of a large diameter lens that can cover that entire spectrum of complex corneal diseases, from an irregular cornea point of view to ocular surface diseases, especially for these fragile and compromised corneas. But you have eliminating that fear factor for many clinicians, and that is scleral shape. We know that when we deal with larger diameter lenses, we have to apply or employ toricity in the haptics, and especially in a quadrant-specific manner. Well, that is elucidated for you with the ESP, and you are also then able to offer these benefits of the large diameters. Another reason why people may not go to the large diameters is because they think they're more difficult to apply. But as our friend and colleague Tom Arnold has said, the limitation of applying a large diameter lens to someone's eyes is actually in the mind of the fitter. And it's important to know that our scleral lens pioneers were all fitting large diameter lenses and doing it every type of patients with no problem. So this is something that is not reserved to just few of us. This is something that is the same skill. If you're able to apply a 17.5 millimeter lens, you can easily apply an 18.5. It's just 0.51 millimeter difference. It's all the same. So let's not be discouraged by this, and this is a great way for us to be able to offer that to our patients. So this is an example of things that we can see and be able to enjoy from the benefits of the ESP and Scleral-Ig combination. You can see that this is a lens that was sent directly to the lab to be manufactured from ESP data. You can see adequate corneal clearance, a very Nice landing in that superior quadrant, very wide distribution. This is an 18mm lens. Very quiet, very nice landing in the nasal, temporal, and inferior quadrant. So these are some examples of what you can obtain when you use the ESP and the Scleral-Ig offering. So just to then end our webinar today, I'm just going to take you through two case examples, one representative of each bracket of that corneal, complex corneal lens spectrum, one in the irregular cornea space, and I'm going to discuss one from the ocular surface disease space. This is a 62-year-old male, history of keratoconus, long-standing history of GP wear, and he's doing well actually with his PP in the right eye. But in the left eye was more involved, status post intact and cross-linking, and he was fitted with a scleral lens prior to being seen by us. But the problem with that eye is that he had difficulty with his previous scleral lens and had intolerance secondary to a tight fit, which resulted in poor comfort. That lens, by the way, was actually a smaller diameter lens. And so when we saw that patient, the vision, by the way, was 20/40. When we saw that patient, we proceeded to take profilometry data with the ESP, and with the image of scleral shape data that we obtained, we send that data directly to the lab, and this is the very first lens that we obtained for that patient. One fit directly from the lab. The patient reported immediate comfort after application, and also long-term, no signs of compression or impingement, and the patient was able to wear this lens for 12 hours or more. It's important to say that also in this case, the vision actually improved to 20/25 versus 20/40, and that is because with the Scleral-Ig, as you do with the BostonSight scleral lens, you also enjoy the benefit of SmartSight technology, which offers different front surface eccentricity options and help to mitigate aspects of high order aberrations, in particular spherical aberration and coma. So they've had a visual benefit as well. And the last case I'll discuss with you now is in the ocular surface disease spectrum. This is a patient with dry eye with objective and subjective signs more pronounced in the right eye compared to the left. In this case, we proceeded to obtain profilometry data from the ESP. This is the image that we obtained for that scleral shape, and we took that data, sent it directly to the lab. And for this particular patient, we chose to fit her in an 18.5mm lens, thinking that that would provide adequate coverage, not just for the cornea, but also for the conjunctiva and the rest of the ocular surface. This is the outcomes for the right eye. You can see that from the very first lens we obtained from the lab, we have good centration, good alignment. The patient is actually comfortable seeing 20/20. This is how the fit looks in the left eye. Very comfortable, great alignment from the get-go, first pair of lenses. In this particular case, we wanted to test the potential of the ESP, and we wanted to test the potential of this image-guided algorithm, in that this woman was more symptomatic in the right eye. So we said, okay, so what can we do knowing that the ESP, we have this image and this profilometry data, can we take that one image, and knowing that with the Scleral-Ig you have 3 diameter offerings, can I take one same data, choose different diameter, get the data that is predicted by the ESP, and send that directly to the lab and obtain a lens? Could we obtain the same results, great alignment, regardless of the diameter, right? And so we did that. We proceeded to do an 18mm lens, took the same data, used our first fit lens algorithm from ESP. Based on the diameter, the ESP is going to predict you a particular scleral shape. We use that data, send it directly to the lab, and we obtain Great outcomes. The patient was comfortable. We had good alignment. We did the same thing for the 19 millimeters. Same data, chose the 19, got the data from the ESP, sent it directly to the lab, and now this is what we obtained for the right eye. Mind you, this is the eye where the patient was more symptomatic. In this 19 millimeter lens, you can see, despite the fact that it's the largest of our lens offerings, how beautifully aligned this scleral lens is, how quiet that eye is. So much so, you can see here an OCT of this lens, you can see the broader landing in this particular case that is given by that 19 millimeter lens. This patient was actually way more comfortable in the 19 millimeter, perhaps because, as I said earlier, we're actually maximizing the coverage of that ocular surface. We're distributing the weight of that lens over a larger surface area. And this patient actually chose to continue to wear the 19 millimeter in the right eye and continue to wear the 18.5 millimeter lens in the left eye. This goes to show the potential and the benefits that the ESP algorithm offers and what you can obtain with the Scleral-Ig and you can leverage for all of your patients. And so with that, I hope that you all get a sense that when we are thinking about the patients that come through our doors for us, right, that we focus in specialty lenses and scleral lenses, and we think about the entire spectrum, irregular cornea, ectasia, grass, or post-archaic, and ocular surface disease cases for more fragile and compromised corneas. With the Scleral-Ig ESP combination, you can tackle most of the patients. And that's why this combination is so powerful. And I hope that you can see this benefit and start offering this to all of your patients.
Thank you for those examples. They really speak loud and clear, and a wonderful case examples. And hey, we're near the end of our video. Just to summarize, you know, DirectConnect between the eye surface profiler and the scleral image guided lens is a most powerful combination. And just from Eaglet-Eye, we're so happy to collaborate with BostonSight.
Well, I will say that we're very happy to collaborate with Eaglet as well. We're excited to be able to extend this offering to all clinicians, but honestly, most importantly, to the patients, right? That's why we do what we do. We want to offer the best comfort, best vision, and most importantly, long-term benefits of ocular health for the patients. And I agree with you, Arnie. It's especially in these times, it's wonderful to have this opportunity and be able to enjoy from these offerings from empirical fitting.
So for anyone who's interested in finding out more, for Eaglet-Eye, you see the information on the right-hand side of the image. We have a lot of information available for you. We can do a very powerful online demo. You're warmly invited to contact us about that. We're very active on Facebook and on LinkedIn, and our YouTube channel contains recordings of all the most recent webinars and trainings that we've given. So you're very welcome to that.
Yeah, and for more information about BostonSight Scleral, our data-driven design, which also has a scleral shape incorporated into them, and the Scleral-Ig lenses, you can visit bostonsightscleral.org. To register for an account, you can go to fitconnect.bostonsight.org, and you can also follow us on social media on our Fit group page, groups BostonSight Scleral. Thank you very much.
Awesome. Thank you, Dr. Carrasquillo. Thank you, and keep in touch to you all. Thank you for viewing this video. Thank you, and bye-bye.
Thank you.